You're now live.
Okay, good morning. And this morning it is Senate Health and Welfare Committee. It is April 13th. And we're going to spend a little bit of time going through H 439, the budget, and the policy recommendations and funding requests that have come to us from the House in our area of jurisdiction. So I asked Faith Brown is here with us today as our committee assistant, and I've asked Faith to put the budget up on our webpage. So H 439 is there, and I believe the pages that we're looking at begin around page 99, 98 or 99. So if you can go scroll down and find that area, because we do want to, I want to ensure that we do spend some time looking at the budget language. Senator Kitchell was particularly interested in that. We look at the budget and what came to us from the House. But I think we're also interested in some of the requests that have come to us from advocates. So that's the budget piece. And as we go through the budget, we're also going to see, and as we have gone through H-171, the child care bill, we know that there is reference to ARPA funds and general funds. And so the distinction between those two and how they're utilized those decisions will be made in appropriations, but I think we might make some suggestions ourselves. So keep all of this in mind as we go through the spreadsheet that Senator Hardy has prepared working with Nolan. I know Nellie got a start to it last week, but Senator Hardy, you've done a great deal of work on this, and we greatly appreciate the work that you've done with Nolan. And there's a lot on the spreadsheet. I think much of it is not in the budget. And some of it is. There's some, and I'll let you take off and take us through it, what you have, but some of it is in some of the bills that we're looking at, and including the House bills that we haven't fully acted on. So that's a good thing. I think it helps us get our feet on the ground with what is in the budget, and then offer our comments, our support, or our lack of support for what's there in the budget. So this is great. So Faith, do you have the spreadsheet that Senator Hardy sent along?
I do. Would you like me to share my screen?
Yes, please. And then Senator Hardy, I'm going to ask for you, and if you need, with Nolan's assistance, if you'd like, we'll go through the spreadsheet and just familiarize ourselves with what you've done, and we can, and then we can go from there. So our goal, just as an overall goal, is to identify those areas that are currently in the budget, or we're seeing that are in some of the bills we've taken up or going to work on, that we would like to have included for funding. So, and we also have this spreadsheet that we can pull up. You sent it to us by email.
Right.
Okay, Senator Hardy, go for it.
Thank you, Senator Lyons. And I will ask for Nolan's help if I need it. So I'll phone a friend if I need you, Nolan. Thank you. So I tried to put everything that I knew about, or things that had been sent to me by other members or people listening out in the world, and also things that were included in H 439, the big bill, and also individual bills that are in our area. And it's sorted. The first section is things that are either in the budget or are in other bills. And then the second section is stuff that's separate requests, but are broader requests, sort of statewide type requests, big picture requests. And then the final category are specific organizational requests from individual organizations or coalition of organizations. So I can go through the first part first, which Faith, I'm sorry, I'm skipping around, but if you can go, yeah, there we go. This part, the first, wait, is this right version? Can you scroll all the way up? Just want to make sure that you have the same version. Yes. Okay. So the first, and then it's alphabetized. So these are not in any, priority order or anything. These are alphabetized within those three big categories. So, nobody should be concerned that something is first, second, or third. The first one is the mental health and substance use funds that are appropriated in the Agency of Human Services. This is $5 million that I believe the agency already has, and it's to make strategic investments to expand the supply of mental health and substance use disorder treatment professionals. This is in the budget, and there is language associated with it, and it's funds to distribute to the DAs and SSAs for this purpose. So that there's a process outlined in the big bill for that. The next several items are all in H171 or associated with H171, which is the child care bill. The first is the $700,000 for the two major studies that are in that bill. The $200,000 for the systems analysis and $500,000 for a financing study. These are not actually, the funding is not actually included in the bill because these studies were to be done in future years, and there's still information, the amounts are still to be determined. Nolan and I had a conversation about this. The $500,000 for the financing study is quite high, so we should probably get more information about that. I think it could be revised down. I think the original study was broader. So that's just a placeholder at this point. And we don't need to include that funding for FY21, I don't believe. The next section is for the stabilization grants. This is actually in the big bill in the budget. It's $800,000 for childcare program stabilization grants, and this is through ARPA funds. So that's not part of H171, but is childcare related. The next is this is just a placeholder because of our discussion about the attendance versus enrollment based reimbursements for the CFAP program. I just included in there CCFAP. I just included it in there as a placeholder. We don't have an estimate yet. We're not sure if we're going to recommend that or not.
But so Ruth, but I think it is important to leave there simply because this is a huge policy decision that we can reinforce going forward or not. So, and we heard from Head Start, for example, how very critical it is. So I think I'm glad that you put that in there. Thank you.
Sure. Yeah, I put it in as a placeholder, and we'll need to get more information on how much it might cost because it would be more expensive. The next item is the major funding that's in H171, and this is to make all of the changes in the CCFAP program, making it family-based versus child-based, and increasing the eligibility subsidy level. So that's the $5,529,000 that is in H171. So that's the big chunk of change in that bill. And then the final portion of that bill includes the scholarships and student loan repayment for childcare providers, and that's $2.5 million. It's broken out in the bill between those two purposes, but I just combined it for the purpose of this spreadsheet. So those are the major childcare related funding that's in either the big bill or H171. And just, stop me if you have questions or comments.
So
Go ahead.
I'm going to suggest that you go down through the top section and the sort of what I consider to be the budget section. And then and then we'll stop there, okay? So
Okay,
go through the things that are in our bills or in the budget, so we can have a conversation there, and then we'll move down to some of the other areas and see how they might group in with what we look at above. You know,
okay,
so I'm thinking like, if there's workforce down below, maybe there's a way to put workforce together up above. So those are,
right, that makes sense. And
yeah,
yes,
okay.
thank you for mentioning that. So I tried to include, included a column. One is a focus, so the area that it focuses on, whether it's children's services or mental health or primary care, so we can sort of get an idea of where we're putting the money, and then the specific thing that the money's going for. So is it going for planning or patient care or workforce or facilities? And so I tried to give us a sense of how we're investing these monies within the broader area.
Good,
Um,
it's good.
Cheryl, did you have a question?
On the, where is it now? You mentioned that the CFAP payments would change from per child to family, and can you just explain that a little more?
Yeah, right now there is a sort of limit, or the subsidy is based on per child subsidization. And the bill proposes to change it to a family rate, basically. So if you have multiple children in childcare, you have a higher subsidy. So it's based on the family, not on the individual child. And I can look up the specific language in the bill, but it basically provides families with additional children. You know, I at one point had 3 kids in childcare. So, you know, it's a heavier burden on families with multiple kids. And this tries to address that by making a family subsidy rather than an individual child.
Okay, because it sounds as if making it a family subsidy would have
It's-
more of a,
It's
ahead.
actually a co-payment. It's a co-payment. So if,
Yeah.
okay,
yeah, so
okay,
you're,
okay,
yeah, so
okay.
yeah, I
Yeah.
know.
Yeah.
And when we go over the bill, I can get the specific language. I don't have it at my fingertips at the moment. I will have to look through the bill, but we can come back to that and I can explain it to you, Cheryl.
You know, I
Okay,
think, yeah, we'll be fine. A co-payment per child is going to be more than a co-payment for family. I think just think of it that way. Yeah.
that's
Yeah.
the
We're
concept,
we're not doing 171 today, so, but that does have implications.
Okay. So the next one I put under designated and social service agencies, and this is the rate increase for DAs and SSAs. And this was, I went back and forth with Stephanie and Nolan about this to make sure that I understood what is in the big bill, but there is a 2% rate increase for these agencies in the bill that amounts to $10.7 million. There have been requests from various people, most of them associated obviously with the DAs or SSAs, to have a higher rate increase. An additional percentage increase is about 5.3 million. So if we went up to 3%, it would be an additional 5.3 million. I've seen some requests for 5%. So if we did that, then it would be 15.9 million more. So that's, but what is already in the big bill is the 2% increase. And I categorize that under workforce, because what they basically, I've heard the testimony or from them that most of it would be used to pay for additional, you know, higher salaries for their workforce, for their staff. The next is the bill H430 that would expand Dr. Dinosaur coverage to pregnant women and children, regardless of immigration status, as long as they're income eligible. The estimate, Nolan's fiscal estimate for that is 1.4 million. That would be general fund money. It is not in the big bill, but it is an H430 for when we take that up. The next is the Health Equity Working Group. This is H210. And it's the sort of working group that moves toward the Office of Health Equity in the Department of Health. And so the estimate is 180,000. This is in the big bill. I believe it's general fund funding. And I categorized it as planning, since it's a work group to try to figure out how to do that. It seems like it was planning population health because it covers more than just specific people, but sort of a broader part of our population. The next is HIV/AIDS services. There are several smaller appropriations embedded in the big bill for HIV/AIDS services. Some of it's for prevention, some of it's for treatment, and some of it's for programming. But I just lumped it together. It's 725,000. I believe, actually, I have it as general fund, but I believe it's a combination of general fund and federal funding, because a lot of it is the Ryan White federal funding. So that's already in the big bill. The next is under Home and Community Services. This is funding related to H-153, which is the study regarding home and community-based service rate increase. Again, it's a study to try to make recommendations for the rate increase and how those rates should be set. And Nolan's fiscal estimate is 200,000. That is not in the big bill, but I believe it is in H-153, or it's at least in the fiscal note for that bill. So also, again, planning. The Office of the Child Advocate, this is in H-265, which is still in the House, but we expect to maybe get it later this week or next week. Again, this is planning on how to implement an Office of the Child Advocate, and Nolan's fiscal estimate for that is 110,000. I believe that would be general fund. And again, planning, a lot of planning. The next item is the Parent-Child Center's ongoing funding. This would be an increase to their base. Their base funding right now is $3.3 million, and they are requesting an increase of 4.2, so a total base funding of 7.5 million. This is in S91, which is a bill that we started to take a look at. It's Senator Westman and I are the lead sponsors on it. And it's a bill this committee has taken up in the past. The next is the primary care education loan repayment. This is Senator Hooker's bill, and this is related to the scholarships, but this would be actually repayment of educational loans. There's not a fiscal note yet on this one because we haven't taken it up yet, but I added it to the list as a placeholder. The next one is the registered nurse and primary care physician scholarship funding. This is in the big bill. It's $2,272,727. I love lots of twos and sevens in that one. This is an extension of the scholarship program that was started last year. It extends it out to 2027. And I did note in the notes, I noted that there's been a request to add nurse practitioners and physicians assistants who are also primary care providers to the program. So there's an updated language request. And, you know, obviously, if we include more people, there may be a need for more funding, or we just split the pie smaller. But I just wanted to note that funding language request. And then the final one is the study on healthcare affordability. This is S120, and there's an estimate of $175,000 in there, again, for planning for an off-session study group. So those are the ones. I don't know if anybody has noted anything I may have missed. I'm happy to add it to the list. These are for the ones in the big bill or in any of the individual bills.
Yeah, this is good. Ruth, you've done a really terrific job and we greatly appreciate it. It's very, very clear. And I do have some emails from folks making requests. I think you got most of them, and I'll go back and check. I did send them to Nellie. They were supposed to be included, but they're not. So that's the way things happen sometimes. So
Okay,
here-
Nellie sent me some, Jenny,
Yeah,
Senator
she
Lyon.
did.
so
Yeah, no, she
I got
did.
some of them.
I don't know whether she sent them all to you, and I'll forward you stuff so you can take a look in a little bit. But
Okay,
I think if you can keep your spreadsheet up, not the one in front of us on the page. I think we'll look at it together on our own iPads. And I think some of the primary care and workforce stuff was also in S-132, which we might look at this week. And what I'm thinking is there might be something in that bill and in 120 that we want to pick up and recommend going forward. Then let me ask you this question as a whole group. There are a number of things that are already included in the budget. And is there anything there that is included in the budget that you have concerns about, that you would like to modify in any way? Okay. So,
Jenny,
Cheryl has her
let
hand
me
up.
just-
oh,
yeah, let me
what do you
just
want to
go
take out,
back to,
Senator?
uh,
Kidding.
actually, I want to add, under the primary care scholarships, and I think we had had a request for mental health. Is this not the place to look at that possibility?
Yeah, no,
of,
hold your comment. We're going to just go through all the lines that are in the budget. So you'll see SH 439 from the House, there are a whole lot of yeses there. So that's not the primary care.
This is the one for the scholarships. It is in the budget.
Oh, where,
Yeah,
which one?
The
Okay, oh, you got it.
2,272,000.
Oh, I
Should we
see,
add
yes.
This would
Sure.
just be to add mental health
Those are
students?
scholarships, they're not loan repayments, just so you know.
Okay, we're looking at loan repayments. Okay.
That's what I thought. Okay,
And-
so,
And
Okay.
one thing just to note, sorry to interrupt, Senator Hooker, the very first item, that $5 million workforce, is strategic investments to expand the supply of mental health and substance use disorder treatment professionals. That, I think, my understanding is that money is supposed to be for broad purposes for workforce development, including whatever.
Loan forgiveness.
It could be used for various things like scholarships or loan forgivenesses, I think.
Okay,
But we
just
might want to
wondering
get
where
more
else we could put
information
that.
about that.
so here's my suggestion. Let's go through this, then we'll turn to the budget language itself after we've gone through
Okay.
this spreadsheet.
All
And
right.
then we'll identify language that either includes the loan repayment or doesn't, and we can add it. So that would be a recommendation we could make for an addition. So Senator Hooker, keep track of that, please.
Yeah, and just to note, it's section E311 of the budget,
Perfect,
E311. And we could easily add language to that.
perfect. So, and as we're looking at the primary care scholarships, I think that also includes psychiatry, which is important in this state.
If it's considered primary care, would that be, because it's specific to primary care, would psychiatry?
It
fall
is,
under
but I
that?
think it also does include psychiatry because we have such a dearth, particularly of child psychiatrists in the state.
Yeah, or we could make it clear that that's included too, in the language change if we wanted to. So I'll just make note of the
So do you want
language.
to keep notes? Do you
I'll
want to?
take notes on the language changes that we want,
Okay.
and I can make a list of those two in the next tab. So,
I think just keep it separately because, we're going to have to be pretty utilitarian and efficient as to make our recommendations. It's my understanding that the budget is moving really fast. So anything we do today and then try and catch some time during the week, that's going to be all the time what we have. And we can get Jen Carby and Katie McClin in to help us with some language. So if you keep notes.
Yep,
maybe- Yep,
I got notes.
you got notes. You're doing great.
Senator Cummings knows I take good notes.
Takes excellent notes.
All right. Okay, she's doing double time, morning and afternoon. So the mental health workforce piece, the $5 million, that is in the budget, and that includes some of the concerns perhaps that Senator Hooker was talking about. The child care stabilization funding, that is in. What is not in, so let's just skip down to what is in. Health Equity Working Group. Does anyone have any concerns about that one? We haven't finished the bill yet, but I know it's at the top of our list. So we're good with that? Okay. And then we talked about the primary care money. Good. Now, so then as we move into the no column, so the planning money, and apparently the planning money should be included or at least mentioned in here. That's what I'm understanding. Nolan, is that accurate? And Ruth, from your work, do we need to have
The
something?
language is in the bill, but Nolan, the reports are due in out years. Is that right? Is that why the money is not actually in the bill for those two reports?
Oh, yeah, it was a combination of, we're talking 171, right?
Yeah.
Yeah,
Yeah, so part of it was, and Katie sent a email about this as well, that the working groups would look at this and determine like what if the ARPA money could be used for it and sort of help guide some of that stuff. So that's part of why it's not in the budget, because it's in the out years, and the working group was going to determine if we could use ARPA dollars instead of regular dollars.
so so then we don't need to have it in. I know it's like a catch-22.
Yeah, the
You don't,
first the first report is due on September 1st, 2022. And the second report is due not until January 15th of 2024. So
Yeah,
I would say building, well, I can really only talk the one that we're doing. For the 200, you might want to hear from Building Bright Futures in terms of what they think the timeline would be, because they were the ones who were going to do the other study.
okay, I can ask Sarah Kenny about that. The 200,000, but the 500 definitely wouldn't be needed in the FY22 budget.
Yeah, I would talk to Morgan Crossman too.
Okay.
yeah, that's good. So the systems analysis piece, which is the 200,000, might be more, that's a closer timeline, and it's probably a little more imminent to get done. I mean, so that's the Bright Futures that you're talking about.
Yeah, I'll see what else I can find about that. And then
Yes,
just
good.
assume the 500,000, which is an excessive amount, I think, for that study.
Right, but it
Just for
seems,
the record.
but it's a ways out. So, you know,
Yeah.
if it's,
And
We don't-
again, it was based on a scope of an earlier version, and
mm,
a lot with Joyce Manchester as well to sort of
Okay.
in the scope a bit to get to more of what they were trying to get at. So
okay.
that I think that we have time to figure out what the cost will be.
Okay, that sounds good.
And so let's do that. And then, so if, I think touching base with Bright Futures is a good thing with Morgan Crossman, if, Ruth, if you're comfortable doing that, but
Yep.
the goal isn't to, our goal, I think, is not to include it unless it's absolutely critical at this stage. Because it's going to be I can't imagine that it would be put back in. That's the way I'm feeling right now. Unless there's some justification for the use of ARPA funds. That's, so thinking about it as a systems analysis based on what's happened to childcare during the pandemic. So that again is a appropriations decision, because we don't know the guidelines yet, and we won't know it for a little bit. But
Right, and there is some money that's in the ARPA bill that
Oh,
is
there's
designated
ARPA
for
money.
childcare.
Oh,
So,
yeah,
yeah.
I think ARPA is being used up completely in the budget, or a lot of it in the budget. So,
So just for context too, one of the things that happened was House Human Services was working on this bill while ARPA was being negotiated. And they passed this bill just around the same time as ARPA. And then afterwards, the speaker went back to them and said, well, is there any chance, you could see if there's any opportunities for ARPA? And there wasn't a lot of time. So that's why they came up with that language. Like, okay, if
right.
maybe because the timing of it was such that there were so many unknowns as the bill was being passed. And there still are unknowns. So
Yeah.
that's why the language is the way it is.
So in some ways, as we go through the bills that we have in front of us, I think most significantly H-171, we may want to identify places where general fund could be conserved and ARPA utilized. For example, as I look at it, I believe that the workforce development piece, the scholarships or loan repayment that's in, there's scholarships for providers, scholarships for workers, and scholarships and loan repayment, I think, in 171.
Well, what I would just add is that we're still waiting on guidance, and that's part of the problem.
Well, can I finish? Because I was just going to suggest, based on guidance, that perhaps ARPA funds are available and the general fund could be more appropriately applied to base funding of Reach Up, because we've
But-
heard from Reach Up. So that's all I was saying. Go ahead.
Okay,
Sorry,
but
Nolan.
no, we cut each other off. My apologies, Madam
Yeah,
Chair.
we're good. We're good.
What I was going to say is that while we are waiting guidance, if the guidance is similar to the previous guidance for CRF, it has to be COVID specific.
Yes.
So, so workforce issues are a longstanding issue. So it's iffy. It depends
It's
on how
iffy.
you frame it.
I know.
That's all I wanted to say.
Yeah, no, I get it.
Has to be pandemic specific and not fundamental. So,
Well, that's why the strategic planning piece, the systems analysis, that one potentially is very pandemic related, because that pandemic exposed a terrible gaps in the system.
well, I think to contradict myself, I think there will be room for creativity as well.
Yes.
Yeah, I think the ARPA guidelines are going to be a little broader also than CRF.
Okay, so that brings us to, we're okay with the H210. That's yes, that's in there. And then the primary care scholarship piece, that's in there. I don't see any reason to touch any of the yeses that we have in front of us. Then,
Yeah, I guess the only question about that one is, did we want to recommend more, given that do we want to add PAs and NPs? And if so, do we want to recommend an increase or just keep it at the 2272727?
well, I would, I think your point is a good one. If we said a minimum of, and that there are additional needs that include, and then if we have a sub list in our recommendations that would be inclusive of our nurse practitioners and others, I think that how we word it, I think, will be important, but let's not lose that. Let's not lose that thought.
Yep, I have it on my list. So
Yeah, good, very good. So we can't recommend everything. This is we're gonna have to be a little careful, but these are the things that we've been talking about in committee now for 6, 8, 10, a long time, many years, and we keep making progress. And if we can continue to do that, that would be great. Yep.
The two things I just want to add to what Senator Hari talked about on the list above is the H-265, the Office of the Child Advocate, still in the House. So you don't have that bill. So when you think about what you're asking in appropriations, you might want to take into consideration whether you have position of the bill in the chamber at all.
Yes, well, that's our next task, is go down the list that's not in the budget and to
Okay.
look at the bills that we haven't looked at and potentially won't be able to pass. And that's one of them. And we don't have the bill. And as much as that bill is very enticing, it will take some time to go over that bill. So I'm going to suggest that that line be deleted.
Should I just take it out completely? I just added a note, but do you think I should take it out completely?
Yeah, I do, because, I mean, we don't have it. We like the idea, but we haven't fully evaluated it. So I think we take it out. And I also think that this pains me to say this, but the other one that should probably come out, and you could put it at the bottom of a list somewhere, are the parent-child centers, S91. The bill itself, but we may have some suggestions around parent-child centers. So that one,
Well, I guess what I would ask is,
strong advocate for our
I know.
parent.
I know that we haven't had a chance to do the bill, but we could still make recommendations for a funding increase in the budget. And so
Mhm.
I would like to leave it in there, just
Yeah, no,
make
that's
a
what I'm saying.
request for additional funding, and we can certainly talk about the level that we feel comfortable with. But
Yes, I agree with that. But it can't be at the top of a list. But I think take the bill out. That's what I'm saying. We don't have time to do S91 and Toto, but maybe there is some recommendation we can make to support.
With 260, with 265, it is in appropriations this week, and you may, assuming it makes it through all different rules or whatever it has to go through, you may have possession of it in the next week or two.
You're talking about 265.
Correct.
Yeah, we're going to
Just-
keep that at the very bottom of the list.
Yes, I might
Well-
not suggest deleting it, but flagging it somewhere.
Yeah, okay, good idea. Yeah, okay.
all right, I will put that one back in, and
Down below somewhere.
okay, I'll make a sub list of
Yes,
of these.
please.
But I just want to make the argument that we should consider. I would like to recommend a funding increase for the parent-child centers, even if we don't get to do the language in S91 yet.
Yes, I think some recommendation on incremental increase to base funding makes sense for parent-child centers. They are the forefront of family and children in our state. There's home visiting, it may be embedded in primary care. I mean, it's just a whole host of things that they do that's so important. So, but okay, so if we start at the top of the list, and I would like us to focus a little bit on the things that are I was going to go to H430 as it passed the House, which is the Dr. Dinosaur expansion. I think there's a strong interest in supporting that bill in our committee. And so it goes along with, for me, it goes along with 210.
Yeah,
So
I
I'm
would.
open to suggestions on how to include that as a recommendation. And so here's the problem, okay? The more we add for our recommendations, if we put all of these things in, if we just took the whole top, with the exception of the full funding of 91 and 265, if we just, modified those, then as you look down below, you're going to see some significant needs that exist in our state. So I'm just, and we know that the child care bill has been a priority right along, not just in the House, but in the Senate. So let's talk child care, H171. So let's start with the study the 200K for the systems analysis. Ruth, you're going to take care of looking at that, and we'll hold that for now.
Yeah, I'll
Okay.
ask about that, but that number will certainly come down from, I
Yeah.
have 700,000 in there. It will come down.
Okay, and then, so we'll rely on that. Then the next one is the stabilization grants. And it seems to me that stabilization grants relate very much to the pandemic.
Yeah, and these are already in the big bill, and I believe it's already tagged for ARPA funds. So I don't know that we need to worry about that. I think it's a done deal.
Right, so let's leave that one in. I'm just doing all the stuff. 171 CCFAP. So that one, which one is this? Is this the 10%? Which
The,
one, is this the 10%?
the next one that I said TBD is,
Yeah,
that one is about the enrollment versus attendance base. And
okay,
that we don't have an estimate on. So I think we're gonna need to talk with Sarah Truckle to get an estimate. And so I just have it in here as a placeholder for discussion purposes. The next, the 5.529, that is the changes in the CCFAP.
that's the CCFAP, and that's the market-based
Yep.
payments.
And-
Okay,
And then the next one is the provider scholarships and student loan repayments.
okay, now, so that, on the provider scholarship and student loan repayment, I would say, let's relegate that to ARPA funds.
Well, I think that's something that the approps committee and JFO will have to figure out if.
No,
I-
yeah,
my
no,
assumption is
absolutely.
They'll be
So-
like, go
But
ahead,
I-
Nolan.
I
Yeah,
would just say again, this is, if we're doing, when you do a bill review tomorrow, you'll see, and in my fiscal note, you'll see that it says general funds or ARPA dollars. And that again is to be determined once we have guidance. So there's language in the bill that will say, if ARPA money can be used, then use ARPA money. If general fund, then general fund. So again, that's the same time.
okay, so I guess what I'm hearing, what I'm thinking as you're talking, Nolan, is if we can act on the childcare bill, and I did put some time for markup on the bill. I forget what day it is, Thursday, I hope. And I don't know if it's
Yes.
on the agenda because of our scheduling issues, but
Yeah.
so we don't need to make this as part of the budget recommendation, except that we would like to have any of our requests that are in H-171 be included in the budget. We can't, because we can't say right now how much that is. Okay. All right. But we
Yeah,
do,
and my understanding is that, first of all, that leadership and the appropriations committee knows this, that there's, money to be allocated to childcare. And I don't know whether this language is going to be going through separately as a separate bill or as part of the budget. So,
well, every time we act on childcare in this committee and work hard, last time we worked for about 3 weeks on it and it ended up in the budget. So that will happen again. That's to be expected. That's part of the process for which health and welfare somewhere exists. So we'll do H-171 this week as much as possible and try and finish it up early next week. And that will probably help us with some of the no's that are in that column. So I'm going to suggest we leave that discussion. But I would say that I know in the bill it says ARPA funding or GF or ARPA. I think we need to be really clear what's not on this list here, and it, not because it was ignored, but if you go down to Michelle Fay below on Reach Up base funding increase, I think that rises to the level of wanting to put something in regarding Reach Up base, and I think that is consistent with our interest in the parent-child center base increases. So if there are general funds available, then yes, Reach Up and parent-child. Has that, do people agree with that or not? I mean, this might,
Yeah, I mean, in looking through we haven't gone through the list. I can go through that next list if you want, Senator Lyons, so I can tell you what I've heard, and you can as well, of those funding things, so we can determine which ones would be our priorities. Should we do
Okay,
that?
let's do it a different way this time. Instead of going through the list as it is, let's pick topics and let's go through topics. So,
The focus areas, you mean? Those?
yeah,
Okay.
but first, the top list. Is there anything there? Oh, the S-120 planning piece, I think there's a lot of interest in that. $175,000. I have no idea whether that's sufficient, but it will be some kind of a analysis of specific areas for healthcare improvement.
Okay.
So we'll just we'll leave that, but I think we should make that as a recommendation to appropriations.
Okay. I'll leave that on the list.
Yeah, I'll leave it. That's a bill
Alright.
that we're going through. It's not like some of the others. And I think Senator Hooker, I think S-123 is there, but can we fold S-123 into some of the primary care scholarships that are there? What is your thinking on that?
Okay, this is loan repayment, and that was supposed to go through AHAC. So
Yes.
I don't know what that means as far as folding into
Well,
scholarship.
why not do this then? Why not ask for an increased support of AHEC for
Mhm,
loan
with a
repayment?
focus on, for the loan repayment for primary care.
And the
Well, actually, there's language in the big bill. I'm sorry to interrupt, but there's
That's
language
okay.
in the big bill that actually puts the 2.3 million for scholarships into VSAC and has them run the program in, I think the language is something like in coordination with AHACs or something like that.
Yes, I do.
Because
That,
VSAC
yes.
is the sort of student loan scholarship agency, they have the expertise and software, et cetera, to do that. So one option, Senator Hooker, would be that we include language about loan repayment in there, and then we make a request to up the funding that would cover both loans and then PAs and NPs.
Okay, loans and scholarships.
Loans and scholarship. That's just an idea as a way to consolidate it all, the three things that we're looking to do.
I would just be clear that like the loan repayment and scholarships are very different and are administered different. And so just keep it clean, even if you put them together, make it clean that they're separate programs, because
And AHEC would do the loan
AHEC.
repayment piece.
and VSAC would be
VSAC would do the
scholarships.
scholarships.
Yeah.
So
This
that's
is
all
the-
I would,
Yeah.
and then keep the money clean, you keep the programs clean, even if they're in the same bill, just make it clear. That's my recommendation.
That is absolutely essential, and I think that would help, I think, on all counts.
I'm happy. I'll add this to my list. I can look into how we might.
You don't,
be
no,
able to do-
I think you don't have to look into anything on that one, just as Nolan said. AHEC is loan repayment, has a very robust loan repayment program. I know some of us have served on the AHEC board and also served on the loan repayment committee. So I think if you just indicate loan repayment, AHEC, and scholarships, collaboration between AHEC and VSAC as it currently is in the budget, I think that works.
Okay. I'll just add that to we'll need language. And then do we want to recommend a funding increase?
To the
For-
extent practicable, I think through ARPA, I don't know how much general fund dollars we could ask for in this environment, but
If I may, I might make the recommendation that you ask first what you want and let the appropriation determine whether it's ARPA or general fund.
good.
You
Good
know what I mean? Like-
suggestion.
Like they're gonna be trying to make it all work. So when you make the request, you can just kind of be like the House was, like, we want it to be either ARPA or general fund, whichever you think works best.
Good. We'll do that.
Okay.
Thank you.
Just an idea.
Yep. I can
Uh,
work with Katie or Jen or whoever will be drafting with this to get the language right.
So, and I think we should probably take some time to go through the language that's in the bill so we can, maybe that'll help too, Ruth.
Mhm.
Senator Hardy.
Pull that up.
We'll see. All right, okay. Then,
So do you want me to go through the next list then, Senator
so
Lyons?
so here's what I was thinking on the next list. Can we pull out focus areas? Is that what you called them? Topics? Okay,
yeah, sure.
categories and focus.
Okay, so
I'm
there
looking
are
at, categories, and so
right
taking,
categories.
yeah. and
Which do you want? The focus or the category? I just made those terms up, but.
Yeah, I know you did, but they're good. So I was thinking, let's start with workforce.
Okay,
Are there
so
any workforce things here that haven't been addressed?
there's one
Yeah.
workforce thing, and I will admit, I put this on because I've been hearing from state workers and constituents who are concerned about burnout among particularly Department of Health
Yes.
and AHS workers who've been just working like crazy. But I think it's probably all state workers who are just really burnt out and wanting to
are.
make sure that they have sufficient staffing support so that state workers can take vacations and reduce their workload back to their normal workload. They've just been flat out during the pandemic. I don't know if there was anything in the budget about this, but I just added it to the list because I'm just concerned about our state workers in the area, in AHS, in the area that we cover in particular, but also kind of all of them, making sure that they are getting the support and the break that they need. So there's no amount associated with it. We could certainly ask Secretary Smith his thoughts. But I just felt like it was important to make sure we took care of our state workers.
Well, I'm hearing the same thing, and I'm really glad you brought it up, that not only are they burned out, but they've been moved around to places where they're not trained to be, and it's made it twice as stressful. So let's think about language that we might put in. There's no, how do you pay for that?
Yeah, I
What-
don't know if it's like
what-
temporary or
Well, here,
short-term
but think of this. So sort of think of this. Think about, and I know, let's just say ARPA. Let's say that there's money available
Mhm.
to provide an incentive, a benefit to state employees who have participated in it's just like any other frontline or essential worker
Yeah.
discussion.
and it's
So it's huge. I mean, and think of, it's just about everyone within the agency. It's absolutely huge.
yeah. And I mean, we even heard in finance, I mean, like the Department of Taxes, they've been pulled into doing things that are, out of
Yep.
they're working overtime, doing grant stuff and everything. So it's not just AHS, but I just
Yes.
added that because it's our area for this committee.
Well, that's why I
Not
brought it
just
up, but
state
it's
employees.
state
You know, I'm
employees.
thinking, our local EMTs have been doing the vaccinating to the tune of hundreds to thousands of people a day. My daughter went at 6 o'clock Sunday night to the Berlin Mall for her vaccination. They're doing now, if not 24/7, at least 12 to 14 hours a day. And that would be a good place to do some ARPA funds or some
Yeah.
more,
Yes. So why don't we say the health and welfare of all of our employees has become a concern of the Health and Welfare Committee, and that we suggest that I don't know how we can't put an amount on it, but we suggest that ARPA funds be used to reward our state employees for the significant additional work that they've done during the pandemic and the vaccination process. So just something general like that. And
Yeah.
then,
And
The-
it's not
I-
even just maybe money, it's time too.
yeah,
like
something.
time to
Support.
take a vacation.
Compensation. Call it compensation. Call it compensation.
And
Yeah.
that's why, Ruth, your suggestion about temporary staff makes me wonder, how do you affect that if it's a function of giving people time off?
Right. And
I
Well,
believe we have a hiring freeze on.
Yeah,
Right. So, and that makes it even harder. I know that people have been told we're not hiring this position. And so people are just burnt. And I mean, I know that we're all burnt and we're, we're not on the front
Well-
lines every day doing this stuff. So, anyway, I think we could include some language and see if we can get some ideas.
okay. Did you write down anything I said?
I did. I wrote it down,
Okay,
Ginny.
so
we
change
can-
the word from, let's change the word to compensation
Yeah.
of some type. And so, and then we'll get Jen Carby or Katie to make it perfect.
Yeah.
Because they'll do a good job with that.
I have it on my list. Okay. So that's the only workforce one in this list.
Okay.
The next is facilities. This is just the sort of balance of the facilities request that we got from designated agencies. We provided 4 million to them in H315. They requested 16.8 for new facilities renovations and maintenance. So that's the facilities one on the list. There are two what I characterized as miscellaneous things. They both are ideas for grant programs. One was specific to primary care practices. The other is broader and it's let's see, includes mental health, long-term care, just broader like innovation grants kind of thing for individual practices or organizations to make a request. This would be ARPA funds because I think a lot of these smaller practices and smaller organizations haven't had time to put together a proposal or think about how they might use the ARPA funds. So there were two, one from Jessa Barnard and one from Laura Pelosi about some type of provider grant.
Yeah,
those
so
are on the list.
this is a tough one, but let's hold this thought as we move into S120, and maybe there's something we can ask for as for analytics on that as we move into our other two bills, 132, 120.
Okay.
Yeah, hold that. And
Okay. So the rest of them are all categorized. I categorize them as patient or client care if they're social services organization.
Mhm.
There's the Mike Fisher, the healthcare advocate, put in a request for funding for dental. I don't know, we did do a dental expansion a couple of years ago. It's my first bill. And I don't know what the result is. We haven't talked about it this year, like how much there's still an unmet need in that area. But based on his work, he says they hear from people regularly as that's one of the most unmet needs is dental. So
Totally.
he put in this request.
Here's what so Ruth, while you're going through this, and I'm looking at the ARPA funding line there, I guess unless we think any one or more of these is not an appropriate request, and we will continue to go through it. I'm not trying to stop you there. I think we might make a little cluster at the end that talks about possible ARPA fund uses. And so keep going through and we'll just hold this as a bottom paragraph and list in our recommendations to approach.
Okay.
Does that make sense to people? Yeah.
Yeah, we can sort of come up with a priority list of, hey,
Yeah.
if there's ARPA money, these are things that might be a good idea to spend it on.
Well, it's true because there was nothing about, there's nothing about health or human services anywhere in that funding. So we're the ones that have to do it. So go ahead.
Yep. So the next one is a Medicaid reimbursement bump for primary care practices. This was a request that we heard last week about increasing the reimbursement for certain primary care codes. Gotta love the coding, to 105% of Medicare. And Nolan can talk about this a little bit more. He's the one that gave me the $1 million estimate. It's about if you include very specific Medicare codes. You want to tell them what you told me?
Question two, as you're doing this, Nolan, this is a fee for service reimbursement process because it's codes. It's not a prospective payment reimbursement rate. So,
Right.
Yes. And so speaking with Diva, so for specific primary care codes, they reimburse at 100% of Medicare currently for, I'm trying to remember the terminology was used. I don't have the email in front of me for providers, and I'm going to hack this a little bit, but for providers who have been like certified that they're primary care physicians, they have like some kind of certification from DIVA or whatever, so that those providers will get 100% of Medicare for those codes, whereas those who are not certified, because anybody can use any code, would not get the 100%. So if you just do it for that, so it's primary care doctors getting primary care codes, it's $1 million. If you just do it on the codes, regardless of whether they are certified or not, I think the number was, and Senator Hooker, I think I forwarded her the email, I think it was like $7 or $8 million. So it's only $1 million if you're specific, and that's gross. So it's only if it's specific for primary care providers for those codes. That's my understanding of it. And I can,
well, to the extent that, this is a big issue for maintaining primary care access, especially in the rural parts of the state. It's not anywhere in the budget. Okay, so let's think about this one. Consider this one.
Okay.
Yeah.
The next one is another request from parent-child centers, and this would be a one-time sort of COVID relief. This is similar to the provider stabilization grants that are going to sort of regular childcare centers. They're requesting $3 million.
And this is
cover the 15 parent-child centers, and this would be ARPA funding.
Yeah, that'll be part of the ARPA piece. Yeah.
The next is the Reach Up base funding increase that you referenced earlier. And there was a bunch of language that Michelle Fay sent us, but I sort of summarized it in the notes section. And we could do we don't have to do anything, but we wouldn't have to include all of the language proposals, but the funding would be is specific to the increasing the grant to align with the 2021 standard of need. And that's 2,770,000. It's another 2 and 7s number.
Well, the base funding increase would be general fund, because once you make a base, you make a base. So you have to keep it there. So it,
yeah, I guess that would be general. I'll
yeah, I think so. I mean, you could try to start it off, but it's ultimately it's going to land in general fund.
Yeah.
We had said earlier that we would sort of make the request that, to the extent possible, some of the scholarship and perhaps loan reimbursement funds that are in the child care bill could be ARPA, and then that the money that's saved there as general fund might be put into Reach Up base. So let's hold that one. Let's keep that one in play, because this just becomes a flat out request that is over and above everything else we're currently considering that's in H-171 and others.
Yeah, I don't think this is necessarily, I don't think necessarily we should tie it to H-171. It's definitely a different,
No, it's not going to go in 171. I'm saying that the money that's in 171 for scholarships or loan repayment, as much as possible could be ARPA.
right?
So if it's ARPA, then that saves all of that general fund. So those general fund dollars can be invested as reach up dollars. So that would increase the base pay. It would put reach up increase the base and put it into the budget as base. Then the scholarships would be reliant on the use of ARPA funding. And we don't know the guidelines, but I'm thinking in my discussions that this is a possibility, that this will work. So I don't want to think about
Yeah.
killing birds, but they're two birds with one stone.
Right. I just think that if we put together what our recommendations are for funding, then the appropriations committee will likely deal with the funding.
I've talked with Senator Kitchell about this, and she would like us to make those kinds of recommendations when we have a
Okay,
kind of clear thought about it. So I think let's do that, just the way we're doing with some of the others on ARPA funding. So we'll shift that one up to the top budget discussion. And
okay.
then, yeah. Do that.
The next one is sort of population-based health. This is the tobacco
Yeah.
control programs. Tina Zook emailed with this request of $1 million for 3 years of ARPA funding. So I just put in $1 million because it would be a 1 year. And this sort of goes to our conversation when we were taking up I can't remember the number of the bill, 420.
S24.
24, the prevention and cessation funding. And she suggested it could be ARPA funded. I don't know. Of course, goes back to the whole, we don't know what we can use ARPA
We don't
for.
know, but we'll keep it there. We'll keep it on the ARPA list.
Yeah,
And just so you know, there was a recent report about actually, I won't go into it now, but the two reports that I've been reading recently, we'll talk about them later.
okay.
Go ahead.
The next one is from the area agencies of aging for their meals program.
Yes.
And I think this came up in discussions in the House, but maybe came in late or something. I can't remember the story, but it's a request for $1 million to increase support for their meals program. I don't have a funding source on it, but I'm going to guess ARPA would be viable because a lot of the funding from CRF has gone toward meals and hunger programs. So.
And they've
Yeah.
been really overburdened with the pandemic, with the number of people that they've increased. And yet once the pandemic's over, they have no idea, what their load is going to be, but
Yeah.
certainly
So
lost.
this is a pretty critical need, I think. I know the Meals on Wheels people have been working triple time, and some of the groups supporting the aging population have been working overtime. So this is a tough one for me. I think it rises really to the top in terms of ARPA funding. So, and I wonder if it belongs in the budget, frankly, if it's a budget recommendation for us. We want to say, rather than put it down as a recommendation, if money's available. So a lot of the decisions will probably be made by Joint Fiscal Committee. Senator Cummings, is that your understanding?
Right now, we've got a meeting at 8 tomorrow to talk about accepting the ARPA grant. Whereas CARES just came to the state as a lump sum, more of ARPA is being given to individual groups.
Mm.
And so joint fiscal is not anticipating as large a role this time as last
Okay.
time, but as things change and mature, will be the fallback.
Okay, all right, so what we'll do is, we'll keep this on the list, and I don't know, I'll have to sort out a little bit what's happened with that in the House, but let's put this up at the top of our list so it goes forward somehow.
Okay, and the final one is the Vermont Early Childhood Advocacy Alliance.
Yeah.
They have some concerns about some of the language that is in the House in H 439. I've had several conversations with them regarding the transportation contracts. I guess
Yeah.
there's a proposal to make a statewide contract, and there's a lot of concern that that would reduce services and be less flexible. So I think we should get some testimony. Matt Levin is the contact on that. And I believe there's some funding in the budget for this, for another thing in their area, but they're also requesting
So,
$200,000 more.
yeah, this is one of Matt Levin's email and information is already on our webpage.
Yep.
So we took it up earlier when we had Stephanie Barrett. I think it was that day. But you can go under Matt Levin's name and find it under our witnesses. But the issue here, I think we may want to make some language recommendations, policy recommendations in the bill. For example, the first one are the special accommodation grants for folks with disabilities. And if the money isn't there, these kids or adults don't get the support that they need. The CIS dollars, I think, are in the
$1 million
budget.
in the ARPA money for that, $1 million.
But CIS is another one where children with autism receive services. So we will want to go back and look at Matt Levin's information on that one. And then so there's a lot there. Okay. Then on the transportation piece, which I think there is language in the budget on this one, we're going to have to look at the other areas, the SAG grants and the child services information, the SAG grants for child services, and then also the CIS to make sure that that's in there. I think it is. And then on transportation, having a statewide contract for special services, the language that's in there says, well, if the services aren't as good as the local contracts have been, then we'll go back to the local contracts. My concern is if you have a statewide contract and it isn't serving people with special needs, what's going to happen to them while they're not being served? So that language really doesn't do it for me.
Yeah, I'm really concerned about it because I know that
Good.
transportation needs are so specific to local areas, and in this case, especially. And I think
So
we need to
Sarah
take a look at that
Truckle,
language.
yeah, when Sarah Truckle comes in, she's the one we can ask about this, I think.
Yeah, I think the agency is actually pushing this language and
Yes, they are.
this change, and so we also should hear from some of the users of it too, maybe.
Well,
So that's-
look at I know you're suggesting a lot of testimony as we go through on all this, but our time is so limited.
Yeah.
If the budget doesn't look like it's going to progress as quickly as they have said, they're thinking next Tuesday. If it's not going to happen, we'll get more people in. If
really next Tuesday, because
Mhm.
but then are we done?
No,
Usually
well,
Then it goes to conference.
they've got conference committee. We got a lot of work to do. Don't
Okay.
put that one out of your mind. Put that
I
one.
was just worried that
Don't
once the
worry.
budget goes, we're done. So
Don't
then,
worry, be happy. Don't worry, be happy.
all right.
uh,
So Do we want to go through the third category and then?
Yes, but I just
Okay.
want to say, Senator Hardy, to reassure you, we may not have time to get all the testimony we would love
Yeah.
to hear. So we're going to go with all of the input that we've had from folks and our own best judgment based on what we have heard.
Okay,
And this is one of them, but I'm not a fan of the transportation proposal.
yeah,
So
neither am
think-
I.
I know. Okay.
Yeah.
All right. So next.
All right, the final group is from, that are I listed as organization specific requests. These came from specific organizations, not a sort of statewide thing, or they're not in bills. The first is a request from a coalition of organizations that includes the AALV, which is Africans living in Vermont.
Yeah, association, and
Association of Africans Living in Vermont. I knew there were two A's, so I was like, what is
we
the
had
other
them
thing?
in. Remember, we had them in early in the session.
Correct, yes, I
talking
remember
about
that.
the
And
money
then, so they also with Connecting Cultures and the Howard Center and
Mhm.
the Refugee and Immigrant Program, the USCRI, they're requesting $385,000 to split between those four organizations for mental health services for immigrants and refugees. Then the next three are all requests from the Brattleboro Retreat, which, as you know, is a mental health, residential mental health facility in Brattleboro. And they're requesting money for facilities, technology, and workforce training. Then the next one is the Lund Residential Treatment Center. Lund is, Jenny, you probably can explain it better than me, but it's a program in Burlington. And they get money that's part of the global commitment money, and they're concerned that they won't be included in the global commitment. So they're asking to have their money more secured. So it's not at the whim of the waiver negotiations for global commitment, or at least that's the sort of basic understanding I have.
Well, I guess this one is tough for us because the amount is flexible, I think. So I think the Lund Home does a terrific job for single female parents, young pregnant women, teens especially, and then childcare, and gets them back on their feet. So if we at some point when we're going around and visiting places, this is a place to visit. But I think this might go up on the top of our list to ensure just a statement to appropriations that we would like to ensure that their Medicaid funding is intact. I think that's the request they're asking for. So we'll
Yeah,
double
my
check.
understanding is that if it's not included in the global commitment, then the AHS or whatever has said we can take care of it in budget adjustment next year. Yeah, so that's why
Okay.
that is in there. Then we have a request from Pathways Vermont about providing funding that would cover COVID vaccine access and education and healthcare access for their population. It was unclear to me how much they were requesting in the email they sent, so that's why I have question marks there. And then the final one is Recovery House, substance use treatment facility. That one is a little under 400,000, 392,700 for facility renovations. So these are the specific organizational requests.
So the facilities renovations, and we have some above with Vermont Care Partners. Those are all going to potentially, let's hope, be supported through any infrastructure guidelines or funding. So I think they are great requests, and we probably should have a little infrastructure section for our ARPA. Okay, and that does go right along with if you're looking at Josephson's request from Brattleboro Retreat, there's a facilities piece, a technology piece, and those two pieces might be separately decided within ARPA and federal dollars that can be handled outside of this committee. And then the workforce piece, I think, I'm trying to remember.
Well, there's 5 million above for workforce for mental health.
Yes, well, that's what I'm saying. This would be
Yeah.
integrated in with that. So I'm
Yeah, I mean,
I'm thinking that's not.
I don't know the specific requests from individual organizations.
Well, I do think that the AALV request is one that might be critically important. And so when we had our stabilization funding, CRF funding, we enumerated specific organizations that should benefit from the funds that we have. So, and I think that that's not a bad recommendation to make to appropriations. I don't know how or if the ARPA funds are going to be distributed by whom and how. We don't know that yet. But
Right.
it's not a budget request, I think, but rather an ARPA stabilization fund request where we're putting all of these ARPA requests in place. If the appropriations committee wants to put those in the budget, that'd be great. But I'm not sure that that's something we can ask for right off the bat. We don't know enough to do that.
Well, there's already quite a bit of ARPA funding in the budget. The House
Yeah.
did put quite a bit in, so I think we can certainly request it. And I agree. I think that request is reasonable and important. I'm just less sure about the other sort of, the Brattleboro
Yeah.
Retreat one, the Lund one. I think that there are other ways to take care of those, but
Well, I think it's a policy statement that we make in a letter. It's not something we're asking to have in the budget, that one, but it's important to us.
so,
So
Do-
that's a note, write that note down.
okay.
That
Um,
would, because when we send a note off to approps, we would ask to have an assurance that the Lund is included in the global commitment and the global commitment process. And similarly, we asked for recovery funds and we got them in H315, and there's nothing else currently in this budget, but this is for one specific organization. So I guess the statement there would be to continue as much as possible with federal dollars support for recovery services.
Senator Terenzini, you've been really quiet. Do you have any thoughts on any of these that are priorities or things you don't want to do? Any thoughts?
No, to be honest, I'm enjoying listening and learning, as this is my first time going through this with the so-called big bill. I'm probably a little behind the pace on some of these, but I'm looking at your list. I think it's well organized, and I agree with a lot of what I've heard. So please don't think my silence is that I'm not paying attention, but I'm just absorbing it. So
Okay, just wanted to make sure you got a chance to weigh in. Please interrupt.
I
if you
appreciate
have thoughts.
thank you.
Yeah. So I have a list of some things. I don't feel like I have a clear priority list though, especially on the middle section on the things that are not in any bill or budget, but are broader requests.
Here's my thought. I think for us having instead of having a spreadsheet go off to approps, we're going to have to sit down with Jen Carby, I think, and help to pull this all together.
Yep.
And so we've said H1's, we've done some work and we know what that is. But on the ARPA piece, I think we're going to list those things that we feel are important to be funded as much as possible with ARPA funding. And some of them I think have a higher priority than others, even though they might be important to us. But at the what's possible, that's what I'm thinking here. So we
Well, I
can,
haven't heard from the committee, the sort of like that priority list. And I can certainly put together a table that's not the spreadsheet, but a
do
table.
that.
of
That would be
recommendations
good.
if, you know, to make it so we could put it in a letter or something.
We're
but
going
I-
to put it in a letter.
What I've mostly heard is like, sure, everything is important. So I really want
That's it.
which is true, but you know, what is the priority list?
Go ahead, Senator Terenzini and then Senator Hooker.
Well, I'll give you one, Senator Hardy, that I'm looking at. The Dr. Dinosaur expansion is critically important to me. And seeing that gets well funded, if not more than what's on this list, is something that I could get behind and support, because we know how important health insurance is for all Vermont children. And so there's one piece that I can really get behind and champion for our committee. So
Thank you.
So
I
that,
completely
so that's
agree.
good, but so we haven't done that bill yet, but so that means we've got to work on that bill post haste. But we'll make that recommendation. Senator Hooker.
We did have a request from adult education, and I'm not
Oh.
sure, where we're going to put that in, but we talked, in talking about Reach Up and the adult or the education piece. Do we need language here? Senator Lyons, maybe, you talked about maybe putting that in on education.
So there, thank you, Senator Hooker, for reminding me. Senator Hooker and I had some communication on this, and when we talked about Reach Up the other day, one of my pet interests came back to the surface. So there are two things. One is providing money for adult literacy programs and workforce. That's one, and that's the one that maybe goes to education. The other one is to include, allow for education to count when someone is on Reach Up, to count as kind of their work involvement or their involvement in their work involvement. So they're two different things. So allowing for education is something that was taken out a long time ago, and we could recommend adding it in. Or we could say this is something we would like to take up going forward in January. So there are two different issues there. So the literacy questions, Cheryl, do you want to talk, Senator Hooker, you want to talk about that a little bit?
I'm looking at some of the language that was recommended. When people have literacy skills that they need, they can pursue further education or careers and have better outcomes. We recommend funding the Vermont Adult Education and Literacy Network's request for $2.8 million for FY22. Including $1.2 million for a statewide outreach campaign to identify and recruit adults and young adults who have not completed high school or have low literacy. So to help them complete that in order to advance their skills. Does this sound as if it would fit in our recommendations here, or do we look to education for that?
I think if it's adult literacy program, it seems
think it-
like it's education, but
And Senator Cummings.
Yeah, when I was on education, we did a lot of work on why aren't students continuing, and there were several models and several groups. I'm not sure that adult basic ed, which they may have changed, tended to be, volunteers sitting one-on-one with folks, working with them. I'm not sure the most effective way, I don't think they have an outreach program. I think VSAC does. I think there are other organizations, grassroots, but I'm not sure they're set up to do any kind of grassroots, and I'm not at all sure that any kind of a media campaign. I mean, I don't know. Is that an effective way to use your money? And I would put that in education.
So I think I'm agreeing with you. I think, well, so Senator Hooker and Senator Terenzini and I will walk down the hall to education with this one. The
Sounds like a
other
plan.
one, I think, is a broader conversation about changing the reach up requirements and allowing for education to count. I think maybe that becomes a heavy lift right now.
Yeah.
So let's look, but please remind me that this is one I think it's important for a discussion, a
It
committee
seems to me
discussion.
that I would be, when we're talking about our priority list of that second group, the reach up increase, I would put toward the top of my list as a priority. But I think that any of those language changes and how the program works beyond the sort of different subsidies, we may want to hold off on so we can get more testimony and do it as a separate bill, maybe next session, and work toward that. But right now, focus on trying to get some additional funding for reach up in the budget.
Totally with it. So that's that's
Okay.
very good. All right, I think this is I know you're going to say, oh, we want to continue with this spreadsheet, but what I would like to do for the last 15 minutes, please, is to move over to H439. I think that's the number of the bill, and go to page 98.
I think
Page-
it starts on 135, actually, Senator Lyons.
I'm looking at page 99.
It's on 99.
Wait. Oh, that's that. Yep. Page 99 has the Department of Children and Families Call Center, Department of Health grants for AIDS. I'm looking at the bill that we looked at with Stephanie Barrett the other day. So, and then I think if what I'm going to suggest is we can go through this a little bit right now, but then ask for you to go through the language in the bill that Stephanie walked through with us the other day and look to see A, what's there that we support, B, what's there that we would like to modify, and C, what isn't there, because we've got a couple things that may not be there that are related to the spreadsheet that we just looked at.
Wait, so I want to make sure we're looking at the same version of the bill.
I'm looking at as passed by House.
Okay.
There's
Oh,
an
I know.
unofficial and an official version, and the page numbers will not match up. So
Okay, at the bottom of page 99, I see what you're talking about, the 126 for 211.
Yes.
Yes, okay.
Yeah. So is that Nolan, do you know, is that, I think it's the official, it's the one that,
But Senator Hardy is referring to the unofficial version.
okay, that's the one I'm looking at. So should
Yeah.
we, let's go. We don't have the official version on our webpage.
Oh, the difference is one has strikeouts and the other one doesn't.
Right. So
Okay,
this is fine. You know what, though, I will just tell you, in my notes, when we went through 439, I had there's language that starts on page 135, which is the human services section. So I didn't actually get these things on our list. So these are not on our spreadsheet. These are different.
no,
These
they're
are
not. And they're-
additional things.
No, they're not meant to be. This is language that's in the bill that we need to look at and I think affirm or not affirm. So Senator Terenzini.
Just for my own clarification, we're on page 99 and it's letter C, 5.7 million for 802 opportunities. Is that what you see at the top of page 99?
Yes.
Yeah, but yes, and then we're moving down to number 12.
Okay,
under
thank you.
that. Well, so let's look at that one for now. We can, what we'll do is, let's all move to the official version when we go through it individually and come back. And so when we go through this, we want to look at the language that's here that we're supporting, language that we'd like to change, policy language, regardless of the money that's there. And then if there's something that's missing, and the only way we're going to know that is by looking at the spreadsheet that we have.
Yeah, well, I didn't put these things on the spreadsheet, so I can add
No,
these.
no,
'Cause I
no,
didn't
you don't have to add them. We just say we support what's in the budget, except we would like to change language, and we'll work with, if we need language change. You don't have
Okay.
to do all that extra work.
Okay.
Not at all. Okay.
Oh, there aren't that many of them anyway, so that's good. Okay.
Yeah, it's pretty short. No, yeah, fascinating to me that this whole pandemic has been all about healthcare and healthcare
And the bus-
services and how much is left. Okay, nothing there. Okay, Department of Children Call Center, I'm good with that. Let's, I think on page 100, recovery centers, there is money in there for recovery centers. So that request from the specific recovery center, I think that's on the spreadsheet is probably covered.
Yeah, that one is for facilities. It's significantly more than this, but
Right, so all the
they are getting-
facilities, yeah, all the facilities requests are facilities.
Yep.
Then the Dale request for adult day, I think that's very important. Department of Mental Health, the mobile crisis intervention that we heard about, that Rutland's been doing, and they've been doing a great job. That should stay in. If you see a language change that you'd like to make as you review this, let me know. But I mean, you're not doing it, you can do that later tonight or sometime before we come back to it. What else is there? What page did you say, Senator Hardy? 135?
it is,
130.
wait, the mobile crisis in Rutland.
Right.
No,
Josh
no.
and Cheryl, you want that or
I
no?
don't know.
No, we're taking that one out. We just put it in, we'll take it out.
That
Wait,
was the first one on the list.
We put that in last year sometime. Okay.
Okay,
moving on.
135, page 135.
Thank
Senator Lyons.
you.
So this is 135 is where the agency, human services stuff starts, and that's what I included in the spreadsheet. So I missed these 5
Yeah,
things.
no, don't worry about the early
Sorry.
ones.
I
Don't
hate
worry
to
about
miss things.
It's okay. Life is full of missing things. It's all right. Page 135. Human Services. Okay, this it continues on. The question about global commitment, as you're reading through this, just look to see if there's any specificity. And then our recommendation that we put in our letter around Lundholm would say, please make sure Lundholm is included. I think something like that.
Yeah, and I wonder, and this is a broader conversation, I didn't realize the budget was going to happen this fast, but regarding the global commitment waiver renewal, I'm wondering, we've had all that testimony on the healthcare financing and sort of broader picture stuff. And given that the renewal of the global commitment is such a huge deal, I'm wondering if I would like to include some more direction that we give them to say these are legislative priorities, and this might cover some of the things that we're discussing related to S120 and S132, but also just that larger conversation that we've had about healthcare financing.
Are you talking about this is the 1115 waiver, which is our Medicaid waiver. But I think you're talking about the Medicare waiver.
Oh, there are two different waivers. Which is the one that's due this week, not
This
this
is
week,
this
this
one.
year?
No,
Am I getting-
Senator Hardy is talking about global commitment.
Yeah, that's what
Oh,
I
you
thought
are,
it was.
okay,
I thought I
And
was.
you're thinking the all-payer model.
I am,
Okay.
Okay, I
Yeah,
wanna
because
make sure we're
global
on the same
commitment is
page.
due December 31st.
right,
The ACO all payer model is not till the following year, I believe.
that's right.
Yeah, so I was thinking that, based on our conversations about
Okay,
that we might want to include more direction, because this happens in the off session when we're not around. And
do you have specific suggestions to make based on what we have heard in our testimony?
I could come up with them. I can certainly work with Nolan and Jen to try to figure out some that I could bring back to the committee. I don't have it right now because I didn't know this was going to come up, but I can, Nolan, can we find time to chat about it? Okay, thank you.
That would be helpful. That would be
Okay.
good. Thank you. Do that.
Yeah, I've just been
And
thinking about it a lot with all of the lovely 4-part testimony we've gotten.
That's what I was hoping would happen. This is good.
And we'll be having more testimony on the two bills that might inform some of the language that we
Yeah,
want.
as long as we can get communication out with our witnesses who are, yeah.
Yep.
Yeah, okay. So, let's move to, that would be helpful.
So
What
then just
we
this,
have-
this first language, I just want to tell you that's in here about global commitment. This is the, this 24, almost $25 million. This is standard language about special education services. I asked Stephanie about this, Nolan, and Nolan got this, and I didn't include it in the spreadsheet because this is base funding.
We
It's
don't-
just
and you
always in there.
I think it's probably best for us just to go through this. I don't think this is something that, the amount, something we have to be too concerned about, but what I'm going to suggest is, because we have exactly 3 minutes left,
Mhm.
is that we go through, each of us go through the language that begins on page, we'll go back to 135, start there. Go through all the budget policy language. I think that, that Senate Appropriations is very much looking is very much looking to us for language recommendations, for policy recommendations. So go through the policy recommendations to make comments and recommendations that from our committee. Then what we have looked at in the spreadsheet today is, some of it is already in there, some of it is not. And we will make a statement in our letter that we will be including requests in H-171. So we have to decide how best to do that. That's our goal. So we may just put it all in there.
So just so you know, the page numbers are 135 to 156 includes the language. So it's,
So that may be different in the official version that doesn't have crossouts, but let's keep working with the one that's on our webpage. So we're all on the same page, literally. Okay. All right.
and Senator Lyons, if you want me to start to put together the language or the letter or table or whatever, let you know what.
I think
That was
because
helpful.
you're keeping notes, and I understand you keep really good notes. You've done a great job on the table. If you don't mind consolidating some of the notes, and then I think we'll take some time, tomorrow's Wednesday, we'll try to take some time with Jen and Nolan tomorrow to put a preliminary letter together that we can bring back to the committee.
Okay.
Is there time in your life for that between
Well, I
now?
think that finance will end by 4 today
Okay,
because of a chairs meeting. Is that right?
we don't have one, but we've got other
Oh.
obligations.
Chairs got canceled.
Yeah.
So I've asked if there's somebody we can put in,
Oh, no. Okay. So I might not have the time.
but we
later
may
this-
not, we may not.
Yeah, well,
This
keep me
evening,
posted.
I can work on it this evening, and then I'll try to get with Nolan and or Jen to do the other language too.
Yeah, well, let's do that together. I was thinking we could do that during agenda planning tomorrow, or we could do that on Thursday if there's, if
Agenda
people
planning.
are available, so.
Okay.
Yeah.
Sounds good.
All right, and if, okay. We're right on time. Thank you all for your thinking and work on this. And Ruth, especially thanks to Senator Hardy. And I know there are people out there watching who are going to think we've missed 1,000 things. And we'll hear, I know.
Yeah, I've
Okay.
already gotten 12 texts from 12 different people.
Glad they're you and not me. Okay.
Ending live stream now.
Bye,
Thank you.
everybody.